Hey everyone, this is Ahmed Farag. I am a now R4 at the University of Kentucky, one of the SIR residents, and one of the co-chairs for the Communications Committee. The Communications Committee is the one that hosts these webinars. Today we have a great webinar organized by Selena Shea. And Selena, this is your show.
Thank you so much. So thank you everyone for joining the Global Health and IR webinar tonight, hosted by the Biodesign and Innovation Committee. Today, we have an amazing presentation by Dr. Andrew Kesselman, who is the Assistant Professor at Cornell and the Director of Interventional Radiology at RAD-AID. He will be talking about his experiences in global health and also how to get involved with RAD-AID. If you have any questions, you can leave it in chat and we'll try to address it at the end. And thank you so much for speaking to us today, Dr. Kesselman.
No problem. I appreciate this opportunity and I appreciate that introduction. So as Selena mentioned, I am an interventional radiologist attending over at Weill Cornell here in New York City, but I also serve as Director of Interventional Radiology at RAD-AID International. And my focus for the talk today is going to be on global health and IR with kind of a training mindset. So for the agenda for tonight's talk, I wanted to split up to 3 different sections. So in the beginning, I'll first talk about the RAD-AID IR program that we helped start a few years back. Then I'll move on and talk about training involvement in global IR. And then finally, I'm going to end in something that's kind of a focus of mine, which is simulation and global IR outreach. So our RAD-AID IR program, just a few facts that you guys may be aware of. About 0.5% of the world lacks access to radiology services. About half of conditions rely on medical imaging for proper diagnosis. And increased use of medical imaging is directly tied to increased life expectancy. So given these gaps, RAD-AID International was started and founded in 2008. And the goal was to increase and improve radiology for medically underserved countries. It's grown to become an organization of greater than 10,000 volunteers, serving greater than 50 million people in over 30 countries. And we started our dedicated IR program in 2017 with RAD-AID volunteers. So everybody who's on our, part of our IR program team, they're all volunteers doing this in their free time, which is great. A main focus of how we do our outreach is the RAD-AID readiness assessments. So the way this works is it's a cycle. We do a RAD-AID readiness radiology assessment. From that, we do some planning. That leads to implementation. Finally, that leads to training of in-country stakeholders and faculty. And then that leads to a cycle of analysis innovation, which then it leads to a new assessment, and the cycle continues. In terms of our RAD-AID IR program, the goals were first to increase access to interventional services in underserved regions, and also to coordinate IR outreach endeavors. We wanted to increase awareness of interventional radiology globally, and we wanted to help develop dedicated IR training programs at international sites, and that's been the main focus of us in the past year or two. In terms of sites, so we do work in a bunch of different sites. RAD-AID has over, I would say, probably over 40 sites, 40 countries that we work in now, with multiple sites in each country. But the focus for our IR program are sites that are ready to progress to IR. And the main ones we have now are Kenya, and we just actually got approval for our fellowship there, which is going to be starting in September. Vietnam, Ethiopia, Ghana, and Nigeria. And those are the main focuses of our IR program right now. But we do have other programs that'll be starting in the future. In terms of challenges in global IR training, there's a lot. And this JVR article in 2019 kind of outlined them and split them into a couple different categories. So they split them into social, logistical, infrastructural, and administrative challenges. And I just want to say that you have to address a lot of these in order to create sustainable efforts in low to middle income countries. So our focus at RAD-AID's been on IR education. So we've come up with a couple of training models, both integrating IR into the residency programs overseas, and then also helping foster creation of IR fellowships overseas. And in order to do this, especially in low to middle income countries, we've come up with some novel training methods. We have a global IR curriculum that's available on our website, and we're building this into a learning management system. We have the Mentis Vascular Simulator, and I'll talk a little bit more about that later. And we have IR webinars that we hold weekly. It's given by IR attendings here in the US that are members of RAD-AID. They're recorded, and the participation is very good with the overseas programs, but they also watch the recorded videos also because a lot of them are at different time zones. And we have VR training videos. So these are virtual reality training videos that are filmed in 3D that you can watch on a headset like Google Cardboard. And we also have curated content guides. So those guides kind of list out some of the videos and things that are related to IR on the internet. This top right photo here is an example of one of our videos that's available on our RAD-AID IR YouTube channel. So what about the IR deployment teams? Well, we do send teams overseas. Right now with COVID, it's a unique situation, but we're hoping in maybe 2021 to be able to resend teams out to do in-country work. Our teams are multidisciplinary, so we have attendings, trainees, nurses, and techs, and we think that's important, kind of to pair, your equivalent overseas, so that and allow the training to go across different disciplines. We do didactics and various levels of involvement in clinical work, and we work collaboratively to reinforce best practices. So what are some things to consider in these deployments? Well, practicing medicine in low to middle income countries requires cultural sensitivity, patience, and a bit of ingenuity. Volunteers often encounter both cultural and technical differences in practice. RAD-AID has a track record and transparency, and we prepare our volunteers and set them up to succeed. So if you're considering volunteering, if it's not through RAD-AID, there's plenty of other organizations that also do outreach in radiology and in medicine. And I think that, those are the main things you want to look for when you look for someone to volunteer with. And to make the most of your experience, prepare educational objectives tailored to your local practice. Keep an open mind and stay flexible, as unique opportunities may present themselves while you're in country. I often get asked about procurement and how we help with that because we notice that most of our partner sites, we see constraints with consumables, and that's often necessitates careful use of the limited inventory that they have. The biodesign committee was participating in some of the efforts that we have that are trying to overcome some of these obstacles. And we help with procurement materials and resources that we provide. So we have a RAD-AID IR toolkit that we provide to our sites that are starting up. We can help with equipment service contract support and purchasing guidance. We have charitable grant programs through some of the vendors that we help prepare with the different institutions overseas to get like a set of supplies to start their program. We also encourage local and regional development of tech and consumables. And we do have management and logistics of donated supplies that come to us. But most of these are shipped with, with volunteers as they go overseas. It's very important to have good collaboration and partnerships. That's what really makes us successful in terms of our outreach. So we've partnered with the SIR, Mentis, Cook, and Burlington Medical for radiation safety. Here's some examples of us doing some overseas work. So on the top left, you can see this. All these pictures are from Da Nang, which is in the central region of Vietnam. And on the top left, that's one of the first CT guided biopsies that was performed there on site. You can see in the middle panel, I'm giving a didactic on ultrasound guided biopsies. On the top right, you can see those are actually the starting residents for the program surrounding this area. Who came out for a symposium that we're having there. And on the bottom right, that's me working with one of the junior attendings there, kind of reviewing a case. This is the Mayo Clinic group down in Jacksonville that went out also to this region to do some volunteer with RAD-AID. And you can see here in the middle panel, in the left panel, they're reviewing some of the preoperative imaging, and you can see that a lot of these are still printed out and left on view boxes. PACS is not always ready available at some of these sites. You can see in the middle picture they're performing a biliary intervention, and you can see there that the stock that they're using is predominantly a stock that we bring over, and then they start their procurement process once they can see what's possible. Here are some examples of some IR being done in Nairobi in Kenya, and this is where we're starting our fellowship with the University of Nairobi. On the left, you can see that's actually their pleurovac, and that's how they hook up their chest tubes. In the middle panel, that's Dr. Dixon from UNC, and you can see there he's working with some of the local physicians there, and they're performing another biliary drainage. And on the right, I put this picture up because I feel like this is a pretty good example of some ingenuity out there. This is how they prepare their sterile probe cover, because they don't have those single-use plastic sterile probe covers that we have. So this is actually a sterile glove and surgical towels here that they wrap the ultrasound in. This is an example from our site in Ethiopia. On the left, there's actually a Korean hospital there in country that some of the fellows from Ethiopia rotate through. And you can see they perform all kinds of procedures there, including TACE. The middle panel shows one of the CR ultrasound rooms that they use as a primary one at the big hospital in Addis. And on the right, you can see one of our nurses doing teachings with the nurses there in country, which I think is really important. This is from a trip from the Penn group that went out to Nigeria. And you can see they held a symposium there as well. On the left, that's Dr. Hunt giving a talk. On the top right, you can see them preparing for a drainage procedure. And on the bottom, you can see one of the technologists giving some teaching there to a group of in-country partners. Okay, so I'm going to move on now to training involvement in global IR. Well, we have the RAD-AID Chapters Network, and that's an extensive network of over 60 university-based academic medical centers. It consists of motivated trainees and faculty with active projects at RAD-AID sites globally. And you may be an institution that actually has a RAD-AID chapter, may not know it, or may not be aware of the activity that they're currently doing. So I do advocate that you go to the website, check out what's available, and see if you can find out if there's actually somewhere at your institution or in your region that can help set up some of these projects. We have a chapter here at Weill Cornell, and our main site, which was a diagnostic site, was out in Black Lion in Ethiopia. It was started by my colleague Joanna, and currently we're trying to also get more involvement from the trainees in the radiology residency. RAD-AID has an annual meeting, so it's held in Washington, D.C. each year at the PAHO building, except for this year because of COVID, so now it's going to be webinar-based. But we have presentations from different sites and programs, and it's a great opportunity to network and make new connections. And here's just an example of the last meeting. So why participate? Well, there's significant opportunities for radiologists to make an impact in global health. You can help address disparities in access to imaging services. People derive greater satisfaction from acting altruistically than being on the receiving end of such acts. And participation has a potential benefit to increase professional fulfillment and decrease burnout. So we have a partnership with SIR, and RAD-AID International and SIR have partnered to give members of the opportunity to teach, guide, and mentor IR personnel at RAD-AID International sites. RAD-AID and SIR are collaborating to offer funded volunteer opportunities to SIR member residents and fellows who serve on RAD-AID teams. So there is a set of separate funding for those trainees who want to come out on RAD-AID trips. In terms of in-country opportunities for you guys, well, those hands-ons with attending and overseas trainees for procedures. Now, for the most part, the attendings are going to be the primary for these and working with the in-country trainees and attendings. But there's definitely opportunities for you guys to help out, observe, and also help with the pre-procedural, post-procedural care and kind of the follow-up with those things. If you're on the diagnostic side, you do read out with the diagnostic radiology departments, and I think that's extremely helpful for them. There's definitely opportunities for didactics. I think from the trainee level, helping with the symposiums and also helping with the simulation sessions that go on, even leading those is a great opportunity. We do need IR assessments, so those are important things to conduct one in country, and then information is available. Also coordinating and all the logistics related to our donations is a big project and something that we can definitely use help with. And in terms of QI projects and department workflow, that's definitely things that that other trainees in the past have worked on. So how do you get involved? When you sign up on the portal, you receive updates. So we have a portal, and we have one specific dedicated to the IR. But if you want to just sign up on your general RAD-AID IR portal, you'll get emails on different deployments that are going out, both diagnostic and IR related. If you're interested in one of these planned deployments, definitely reach out to us specifically for the specific leadership that's involved with that trip. You can establish contact with the RAD-AID program managers for each site, and I can help you get hooked up with somebody if that's an interest of yours. And you can work with your GME on getting elective time approved. So we actually have a GME elective for our residents that's approved at Cornell. So getting that in place is nice, so that you don't have to reinvent the wheel each time a trainee wants to go out and not use vacation time. And there's also sometimes funding through your department, so you should look into that, especially those that have a global health division within your institution. Also, Doximity has a grant that you guys may or may not be aware of for those traveling to do overseas trips. Now, right now it's on hold because of COVID, but once that starts up again, that's a good opportunity. And then again, SIR through the collaboration with RAD-AID also has some funding opportunity. All right, so I'm moving a little bit faster than I thought I would. And we've already gotten to my third topic. So I'm going to talk a little bit about simulation and global IR outreach, and this has been kind of an interest of mine. It's something that I've worked hard on the past couple of years to kind of expand its role. So in January 2019, RAD-AID and Mentis started a partnership focusing on simulation curriculum development at overseas sites. And for those that may not be familiar, the value of simulation is that it allows trainees to gain familiarity with the equipment, learn key procedural steps, and practice technical skills in a risk-free environment. And that last part's kind of important, especially now with COVID. So our focus on this was on high fidelity vascular simulators. We've been using low fidelity simulators like ultrasound models and breast biopsy models overseas for quite some time. But this was something novel and new. So we wanted to provide hands-on practice of endovascular procedures performed in a simulator environment. We needed multiple types of endovascular procedures, and thankfully these units are available ranging from peripheral angiography to complex aortic interventions. The benefits are that it's reproducible for objective evaluations. There's no increased need for disposables, so that's huge overseas, right? And in considerations for these units, especially for the work we're doing, it needed to be portable, durable, and provide a realistic experience. So this is the unit that we wound up focusing on, and this is what we have available to us through our partnership with Mentis, and it's a VIS G5 simulator. It's a high fidelity, low footprint simulator. It packs into 2 flight cases. So that means it can travel with volunteers in their check-in luggage. It consists of a screen, laptop, and VIS control box. It supports real clinical devices. So that means real microcatheters, real base catheters, wires go into this unit with just a little bit of minor modifications. And there's on our unit currently 20 procedural modules, including UAE and vascular trauma management, which I think are important for us to teach to some of these overseas sites. This is what our unit actually looks like. These are pictures of our actual unit. So you can see that the main Mentis unit here is where the catheters and the wires go through, if you guys haven't seen it before. And the images that actually come up look like live fluoro images. So why use simulation in global IR outreach, right? Because what we've discovered is that there's a real lack of consumables available, right, overseas, and that can lead to a lack of procedures being performed, and that in turn leads to lack of training exposure and competency, right, and issues with competency. So high fidelity simulation decreases the needs for consumables to gain exposure, comfort, and competency, right? So it can overcome some of these barriers, right? And that way, when they do need to use their consumables, the small amount that they have, they can really focus on those life-saving procedures and feel comfortable doing them. What are some challenges in starting a simulation program, especially overseas? Well, for us, it was the initial cost, right? And thankfully, we overcame this with a donated unit as part of our RAD-AID Mentis MOU. They actually continue to support us, and we also have donated supplies that we use with the unit, so the microcatheters and the base catheters and the wires and things. Now, there's going to be some wear and tear related to that, but thankfully they've offered to give us support. In terms of travel, there's costs related to that, and we rotated between our different RAD-AID sites. and it travels with our volunteers, as I mentioned before. We also do in-country FedEx shipping to get it around the US to those going out. We developed a curriculum, and there's didactics that are given by RAD-AID volunteers that go out, and that's definitely a role that trainees can be involved in. We built this also into our learning management system that's going up shortly. The modules that we have built into the Mentis unit that we have, we've kind of combined them into 4 different levels. So level 1 is filter placement and basic transarterial chemoembolization procedure. Level 2 is a basic uterine artery embolization and prostate artery embolization. Level 3 is pelvic bleeding and PAD, iliac and SFA lesions. And then level 4 is challenging transarterial chemoembolization in a PAD case for a below the knee lesion. And although they may not be performing all those procedures at their sites, it's good to get this kind of skill set built, especially microcatheter work, in case they want to do some kind of like life-saving intervention again. Each of these modules we provide recommended readings, and we can actually track metrics for different users on our system. And then we also have RAD-AID IR volunteer feedback sessions after we do things like symposiums or a week long of work. So here's some example pictures from our IR simulation workshops overseas. This is from both Nigeria and Kenya. Here's me using it in Vietnam. And here we did a symposium. So we had instruction from volunteers. We had hands-on demonstrations using donated supplies. We did have also those ultrasound models for access and biopsy. And then we had the Mentis and the Vascular Simulator set up for small group use. And we like combining these for symposium, doing either a 1-day or 2-day event, which is great. Some more pictures of us doing work on the simulator. And here's some of the trainees using it, getting a lot of great use out of it. The nice part is they can practice, they can make mistakes and not feel intimidated for not knowing certain things about the procedure. Just a few more examples here. And on the right, you can see that's one of the volunteers going out and setting it up and just FaceTiming with me over the phone so that they can set it up. This last concept I wanted to touch on, which I think is important and something that we looked into in our global IR outreach, and it's simulation to suite. So basically what we started with, this is a week-long endeavor that we did in Tanzania, and we did initial uterine artery embolization didactic, so I did that with them. And then we completed the UA curriculum module on the Mentis. And those practice sessions were held Monday to Thursday with the trainees here, as you can see. And I gave an opportunity for each of the trainees to practice. And then finally on the last day, on Friday, we did a live uterine artery embolization case in their angio suite, which you can see on the right. Thankfully, we had good technical and clinical success with that procedure, and it's a good concept to see how the simulation use can really improve outcomes for them overseas. All right, so just some take-home points. RAD-AID IR is dedicated to increasing access and global awareness of interventional services. We hope to create sustainable training programs and making a lasting difference in the global medical landscape. And endovascular simulators offer a variety of opportunities in global IR outreach, and we hope to kind of expand their use going forward. This is my email. The next one is our actual RAD-AID IR page, and the last one's our YouTube channel. So I can definitely share these slides with you guys if you're interested. And I thought I would give a lot of time for questions if there's any from the trainees about any of these things or other aspects of getting involved. Thank you.
All right, thank you so much. So if anyone has any questions, please feel free to leave it in the chat. I guess we can wait a couple of minutes to see if anyone has any questions, but if not, thank you again, Dr. Kesselman, for your great presentation and for sharing all these opportunities for us to get involved with. So your work with RAD-AID has clearly been really impactful globally. So thank you so much for working with us, the Val Design Innovation Committee, so closely throughout the year. And then also thank you to everyone for joining us tonight for the webinar.
Yeah, no problem. I really appreciate this opportunity to talk to you guys. And I can give you a little more background on me and my journey to RAD-AIDs and global IR outreach. So I started as a resident, actually. From my background, I'm actually half Filipino, and I went out to the Philippines early in my residency to see if I can do any IR outreach, and I did this kind of independently. And I found a hospital there that would, let me do readout with them, which was great. I came back and I was looking for somewhere to kind of present this work, and that's how I found RAD-AID. So I presented at actually one of the annual meetings, and one of the leadership from RAD-AID came up to me and asked me if I would be interested in doing more of an active role, and that's kind of how I got started. So I think, again, the annual meeting is a great opportunity for you guys once it gets started and going. And this year it's web-based, which is also a good opportunity, a different opportunity, but also good. But I think that's a good starting point, especially if you're interested, and also if you have a chapter, kind of looking into your chapter. And then I first started actually in the informatics section. And our main goal was getting PACS into a lot of countries. And it was really interesting seeing that, especially from the diagnostic side during my diagnostic residency, because I didn't realize that a lot of these countries didn't even have, the opportunity to view on, on our workstations like we do here. That a lot of them are looking still on view boxes printed, even though they do CAT scan, printed images on a view box, or even if they're looking at images on a computer, it's usually through a DICOM viewer, not so much on a real traditional PACS like we have. So there's not the opportunity for looking at comparisons and things like that. So our main goal was getting introduction of PACS into a lot of these country sites, and we were very successful early on, which was great, forming a relationship with a couple of the PACS companies, and that's a lot of the work that I did initially when even as a resident in my last year, was setting up PACS in some of these countries. So that's definitely an opportunity for you guys if you're interested on that on the diagnostic side. And if you're really into innovation and kind of like new technology, that's a great aspect to look into. And then, then I went into fellowship and I became an IR attending, and kind of my focus shifted to IR. So this is what we've done so far in the past few years.
All right, looks like we have 2 quick questions here. The first one says, how can medical students get involved with RAD-AID, or is it aimed more at resident and fellow attending involvement?
That's a great question. So, you can definitely get involved as a medical student, and it's great to hear that, so early on that you guys have an interest and you're kind of aware of what's going on, which is great. There's a medical student program specific in RAD-AID. It's run, I think the leadership's run by UFARA, who's through RAD-AID. So if you want, you can shoot me an email. I can get you hooked up with her, or if you visit the medical students section on the RAD-AID webpage, you might be able to get her email from there. There's a course that they have you take that goes over the global health stuff, and they can help link you with projects that are going on in country too, so that when we send deployments again, that you'll be able to get active. Your role is going to be different than the trainees or the attendings, obviously, but I think there's still exposure to be had, and also some guidance that you guys can give. Kind of your experience in the U.S. kind of can play off the medical students' experience over there in overseas sites. So hopefully that's helpful.
All right, another question is, would an IR RAD-AID volunteer elective count towards IR rotations for ESIR?
Oh, that's an interesting question. So much has changed with our training paradigms here in the U.S. That it's hard for me to directly answer that question. I think that you do get elective time during the last year as ESIR. So assuming that you get it as a formal elective to the GME, that it should count. And usually they require a 2 to 4 week elective rotation. But that's something that I think you would have to clear with your individual institutions, to be honest. So sorry, I can't answer that directly. I know we are trying to get it. I know we have an elective approved for 2 to 4 weeks, but I don't know if that's specific on the diagnostic side, whether the ESIRs have a specific, a different kind of requirement. So I know I didn't answer that question, sorry, but I think, if you speak to your program director and if you have a formal rotation, I think it's going to help.
Looks like the last question here is, what do you think is the next big thing in terms of global health and IR innovations?
Oh, another great question. So I think the next big thing in global IR outreach would be, well, I think simulation played a big role this year for us, especially. But I think going forward, what I'm seeing a lot of even here in the US is like incorporation of other kind of innovation in terms of augmented reality and VR. So I think those things might take off. And I don't think there's as much barriers in terms of technology these days, given everybody has smartphones and all these things overseas. So I think there may be some opportunities even there for them to come up with some creative outlets for that. So I think those are probably the ways we're going. think the biodesign had a lot of good ideas in terms of what we're doing in outreach too, the committee when they had the challenge. So I look forward to some of those things coming to fruition too.
And then we have a follow-up question to the last one. It says, with the new IRDR residency, the schedule is fairly tight throughout the year to satisfy ACGME requirements. How long on average are the trips, and do you have any suggestions on how to position this with leadership to get approval?
Yeah, so that's a good question. It is new tight in this new training paradigm that you guys have, because we are trying to, you know, increase the clinical emphasis. I think again, yeah, our rotations are usually 2 weeks at a minimum, sometimes 4 weeks. Especially for the funding, it usually requires a 2-week minimum rotation. So good ways to kind of, I guess, get that initiated at your program is, I guess, speaking to early to your program director and kind of highlighting, you know, the specific goals of your trip beforehand and having kind of a good outline of a plan if that elective time could be built in. Which we can definitely help from our leadership roles, kind of provide you with the framework that we've used in the past, just to make sure that happens. But I do agree with you with the new IRDR training program. You know, your time is tight, so it may be a little hard to build an elective time. But any opportunity that you can, I think it would be helpful, because you'll gain that exposure, and then if you decide later on in your career, post fellowship, to come back as an attending and do your volunteer trips, I think that's great too.
All right, looks like that was all the questions.
All right, well, I appreciate you guys' time. My email's up here, so feel free to email me if you guys have any additional questions or if there's anything I can help direct you towards in terms of outreach. And I do want to highlight, you know, I spoke a lot about the organization I work for, you know, RAD-AID as a volunteer, but there's other organizations out there doing radiology outreaches, Radiology Without Borders. There's the Yale Outreach Group that's doing a specific IR site actually in Tanzania, and they've been doing a lot of great work. And there's a couple other nonprofits out there doing some outreach work. So you can also look into those too as well. All right.
All right. Thank you so much again for speaking with us today. It's been like really informative and really great for all the people here, I imagine. But yeah, so thank you again for working so closely with our committee this year and for helping us during the bio design competition as well.
No problem, no problem. And again, it was great being able to give this talk. I really hope it was helpful for some of you guys and kind of highlight some of the things that are possible. And I hope everybody stays safe out there.
All right, everyone take care.